Lord Young of Norwood Green.
My Lords, I wish to move the question standing in my name on the order paper.
NHS England commissions children and young people's gender identification services. All patients at the Tavistock Gender Clinic receive psychological, physiotherapeutic or psychological training. Following the CAS review interim report, NHS England is bringing the GIDs contract to manage close and transitioning gender services to new providers that will deliver holistic and exploratory counselling. Existing patients will continue under the current care arrangements until they are transferred to new services based in specialist paediatric hospitals.
My Lords, I thank the Noble Lord the Minister for his reply. But I'd like to probe a little bit more on this. Does he recognise that 80% of the young people, many of whom are girls on the autistic spectrum, are diagnosed with gender dysphoria, and when they reach the age of 18, they realise that they've gone through a perfectly normal process of puberty. They might end up being gay or lesbian, but they certainly didn't need to be prescribed with puberty blockers, which are a serious medical risk. So can the Noble Lord the Minister assure me that steps will be taken to ensure that those young people receive the appropriate counselling? It could be via CAMS, but what it can't be, as he rightly said, is through the discredited Tavistock Clinic. And I would like to meet the Minister on this issue as well. Thank you.
Yes. Again, I've said before, it's actually one of the privileges of this job that you actually get to learn about new areas, and I thank the Noble Lord for this question because it's something that I've enjoyed becoming educated on the last few days. Very happy to meet with him. The points he makes are absolutely right. A lot of these people have, as they say, other issues, and going through puberty is a difficult time. So the lessons have been learnt, and we'll make sure they're implemented.
My Lord. My Lord. I want to thank the Minister for his very thoughtful reply to that question and his curiosity about this subject area. I think there are some issues and data that's just been shared that are subject to debate and aren't quite as substantial as has been suggested today. I wonder if the Minister could answer when this transition to these new services might happen, because at the moment those young people who are on that waiting list have no knowledge of when they will be transitioning from the Tavistock to another service. There are those who've been waiting for an appointment since 2019, and 4 years is a very long time when you're a teenager, let alone when you're 43 and a half a grown-up. So, and we also know that that period is a very confusing time. So can we get some clarity for those young people about when they will be seen, by what service, and how quickly they'll be able to get onto the system? Thank you very much.
So my understanding, and again, the points are well made and understood and accepted on this side. My understanding is actually the northern and southern hubs, as recommended in the CAS review, have already been set up. So patients are being seen at the Great Ormond Street and Evelina centres, is my understanding, as we speak, and a transition programme put in place for all those people who are currently there. I will happily pick up with the noble lady after this to discuss further.
My Lord. My Lord.
Children and adolescents at the Tavistock Clinic was greater for the autistic group of people than any other. Would my noble friend just clarify a little in the reply he gave to Lord Markham? Because I think it's going to require a little more than just normal counselling, because there is a trait within the autistic mind that very often focuses very, very strongly on a particular issue. And once an autistic person believes something is true, it's actually quite hard to get them to see something the other way. So it's going to need expertise. What actually is being done to find those experts?
My noble friend will be aware that I do have some personal knowledge in this area, and I recognise very much the point made that neurodiverse people can become fixed on a certain outcome. In terms of the statistics, yes, as many of a third of the people seen at Tavistock do have those sorts of conditions. So it is something that is understood. Again, I'm happy to pick up afterwards, but they are having... the key point of the CAS review in all of this is these people need to be seen by medical doctors who are considering everything in the round in terms of not just coming at it from a gender identification lens. And that's the key thing we need to make sure happens going forward.
My Lords, whatever one's views on trans issues, surely the first imperative is to ensure that young people are properly looked after. So would the Minister agree with me that every young person suffering from gender dysmorphia, whether they have attended Tavistock or not, should receive professional counselling and support? And if he does agree, can he ensure that the resources are available in a timely manner, not having to wait years while they try to unravel the complex set of issues they face concerning their gender identity?
Again, my understanding, and I freely admit I'm, again, the benefit of having these questions is it means it's something that you then delve into, and something I very much support in terms of how this process works very well. So my understanding is that these people who've been through these services need to be looked after and catered for, and so that is something very much that we're on.
My Lords, leaving aside the issue of the serious psychological problems that some of these children undoubtedly display, can the government clarify one issue? Do they regard so-called gender dysphoria, which is a very broad term, as a pathological condition, or is it simply a medical or, if you like, a pure choice on that individual? And therefore the question is, at what stage should the National Health Service be intervening in these cases?
I feel I'm probably outgunned to some degree by the by the noble lord here, and so I think I would like to make sure I answer that in the proper way, and so make sure I give you a detailed written response, and happy to follow up because I want to make sure I'm answering in completely the right way.
My Lords, the Times of 23rd February reported that GIDS patients are still receiving puberty blockers. What arrangements are in place, as recommended by Dr. Cass in her report, to monitor patients who receive treatment, both during it and in subsequent years by way of follow-up, to ensure a proper longitudinal study of their effects?
My noble friend is absolutely correct. One of the main findings from the CAS review was that more research has to be done in the whole space of puberty blockers. That's something that the NHSE is moving on as we speak. At the same time, I can assure the House that from now on, no puberty blockers are able to be prescribed unless they're part of that research programme, because it's vital that that's something that doesn't happen as a matter of course until we understand far more in this subject.
My Lords, the CAS Review interim report underlined that the expansion of gender identity services to regional centres can only be successful if the NHS can attract and engage the workforce within those centres and for crucial network secondary services. This week, however, as we heard, we've seen just how under pressure these key services are. Over 250,000 children in Britain with mental health problems are awaiting NHS referral due to major shortages of psychiatrists and specialist nurses. How are the holistic, person-centred services that young people desperately need going to be provided in the continued absence of a clear government workforce strategy?
I'm glad to say that there is a workforce strategy, which I know, unfortunately, we haven't been able to publish yet, but I can assure that a lot of work is being done, and there is a lot of work in place. And I'd be happy to meet the noble lady and go through the findings of that all, because it does need to absolutely cover a lot of these specialisms.
Contribution from Baroness Brunton.
My Lords, in replying to Lady Hunt's question, the Minister referred to the new GIDS service at the Evelina and Gosh, But the original proposals were for regional clinics in Manchester and London. So when will the Manchester clinic open? And since March of this year, the waiting list and all new referrals are being held by the Arden and Greater East Midlands Commissioning Support Unit. There's real confusion about how this list will be integrated with the existing caseload as the new services open. So can the Minister explain what will happen? And if he doesn't have it to hand, please will he write to me?
As ever, very happy to write. In terms of the Northern Hub, I just mentioned Gosh and Evelina as examples. The Royal Manchester and the Alder Hey are seen as the